Hi, and welcome to another Ask Mara. Today I'm going to talk about what to do if you get bit by a tick. Unfortunately, not everyone who is bitten feels the tick bite, but those of you that are bitten need to seek immediate treatment. When you go to your primary care provider, if you don't have the bullseye rash, which can be seen in as little as 25% of the people who get bit by a tick and know it, then they're not going to do anything for you. And if you insist, you might get lucky and get 2 weeks of doxycycline at 100 milligrams twice a day. If we treat with doxycycline, we give 200 milligrams twice a day if you're Lyme literate provider. I was talking to Dr. Lee Cowden a few weeks ago, and he is very concerned about the amount of doxycycline being distributed without the use of something to bust up biofilm. Biofilm is formed by all of these bugs, and it's a place where they hide, it's a place where they persist, and you have to do very specific things to dissolve this biofilm. He told me that in studies it shows that the use of doxycycline pushes a portion of Borrelia into biofilm and the dormant cystic form within 2 hours after the first dose. So I currently now give 200 milligrams of doxycycline 2 times a day if you're not going to be exposed to the sun, and 100 milligrams of minocycline 2 times a day if you are. Now I add Cemento and Banderol to that protocol. They are 2 herbal tinctures, and Banderol actually breaks up the biofilm and goes after other bacteria that might be in the tick bite besides the Borrelia. So I will keep people on this for a minimum of 8 weeks, and again after a month I'll run the IGeneX Western blot to see if they show positive. And if they do, I will continue treating, probably with the 2 herbals, depending on if they have symptoms. Frequently, people who have an acute tick bite and go on antibiotics right away will have a mild Herxheimer reaction. They'll start to feel a little fluey. They might get a little joint. Their joints might ache a little bit. They might be especially fatigued. And if that's the case, to me, that confirms that truly that tick bite had Lyme, or they've been bitten before and this just made it worse. So please find a Lyme literate provider if you're bitten by a tick. At Gordon Medical in Santa Rosa, where I practice, we treat pretty aggressively because we don't want to see these infections go into their chronic form. So the other thing that we've been starting to do, because of a study that came out in Germany recently, is if you can get to us right away, we have an azithromycin 10% cream that we can prescribe, and you can put it on topically. The studies show that the Borrelia will actually stay in the surface of the skin for a few days before it starts to burrow into the body. So if you get that cream on right away, it's looking very promising that that might be the only necessary treatment for an acute tick bite if it's applied immediately.
What do you do with the tick?
A lot of people save ticks. If you find a tick on you, embedded in you, and you want to take it out, use a pair of tweezers and pull it straight out. Do not twist it, do not put chemicals on it, do not heat it. It's really important that you push down into the skin and get the head. You do not want to squeeze the body of the tick, because if you do, you will release other co-infections into your body. So pull it straight out, and then I usually don't recommend testing the tick, because if it dries out, if anything happens to it, it comes back negative and it can be a false negative. I just don't trust the test yet.
And is the bullseye rash 100% diagnostic?
Yes, and if you have a bullseye rash, you have Lyme disease. It is 100% diagnostic of Lyme disease.
And if you don't have the bullseye rash, you should still get tested?
Absolutely. See a Lyme literate provider close to you to get the proper amount of antibiotic and herbals, or herbals if that's your choice. I believe the herbals are as effective as the antibiotics are. Even if you don't have the bullseye rash, you could have Lyme disease. Please see a Lyme literate provider.
Don't let it go chronic.
Don't let it grow chronic. You don't want it to go chronic. So I hope you enjoy my Ask Maras, and be sure again and pick up a copy of Nature's Dirty Needle. to share with your families and friends. It's a simple read, and it really tells them what's going on with these infections and how it's impacting you. And you'll get more support if they read this book. Thank you. Be
Questions?
sure to leave your questions on Nature's Dirty Needle on Facebook or on YouTube. See you next week. Bye.